Your doctor told you PCOS is a lifelong condition you'll just have to manage. They prescribed birth control, told you to lose weight, and sent you home. But here's what they didn't tell you: PCOS isn't actually about your ovaries. It's about insulin. And in the next few minutes, I'm going to show you exactly how the medical system has been treating the symptom while ignoring the disease, and what you can actually do about it. Stick around to the last minute, because somewhere in this video, I'll reveal a therapy that can help with PCOS, insulin resistance, and fertility management. Let's start with what brought you here: fertility. Because if you have PCOS and you're trying to conceive, you probably heard some version of, "It's going to be difficult." Here's the truth. PCOS is the leading cause of female infertility. That part is accurate. But here's what they leave out. 20 to 30% of women with PCOS conceive naturally, not with IVF, not with thousands of dollars in fertility treatments. Naturally. So the question isn't, can I get pregnant with PCOS? The question is, what's actually stopping ovulation, and how do I fix it? And the answer comes down to one word: insulin. Let me explain what's actually happening in your body right now. Your cells have stopped responding to insulin properly. So your pancreas starts pumping out more insulin to compensate, sometimes 2, 3, or even 5 times the normal levels. This isn't about eating too much sugar. This is a cellular signaling problem. Now, here's where it affects your fertility. Your ovaries have insulin receptors. When those receptors get flooded with excess insulin, they do 3 devastating things. 1, they produce excess testosterone. Now a little bit more. We're talking levels that are 2 to 3 times higher than normal. That testosterone prevents your follicles from maturing properly. The follicles develop partially. That's the string of pearls you see on ultrasound, but they never release an egg. 2, that testosterone converts to estrogen. Sounds good, right? Wrong. It creates unopposed estrogen that thickens your uterine lining abnormally and blocks the LH surge you need for ovulation. Your brain is screaming, "Release an egg," but the hormonal traffic jam means your ovaries can't hear the signal. 3, the high insulin creates oxidative stress in your developing eggs. So even if you do ovulate occasionally, the egg quality is compromised. The cellular machinery that's supposed to create a healthy embryo is damaged by the inflammatory environment created by insulin resistance. This is why women with PCOS don't just struggle to conceive. They have triple the miscarriage rate in the first trimester. The insulin problem doesn't just stop at conception. Now, let's talk about what your doctor prescribed: birth control. Birth control does exactly one thing for PCOS. It masks the symptoms. You get a regular period, except it's not actually a period, it's withdrawal bleeding. Your hormones aren't balanced. Your insulin resistance hasn't improved. Your eggs aren't developing normally. You just put a Band-Aid over a metabolic crisis. And here's the kicker. When you stop birth control to try to conceive, all those symptoms come roaring back, often worse than before, because you've lost months or years where you could have been addressing the root cause. If your doctor prescribed it as a treatment for PCOS without addressing insulin resistance, they've done you a disservice. So how do you actually fix this? How do you go from irregular or absent ovulation to conceiving naturally? It comes down to reversing insulin resistance. And I'm going to give you the exact framework that can help you. Step 1, strategic nutrition that directly targets insulin sensitivity. This isn't about eating less. It's about eating differently. And the single most powerful change you can make is this: eat protein first at every meal, minimum 30 grams at breakfast. Here's why this works. When you eat protein before carbohydrates, you reduce the post-meal insulin spike by up to 40%. A study in the American Journal of Clinical Nutrition proved this with continuous glucose monitors. The exact same meal, just eating the protein first, cuts insulin secretion by nearly 1/3. Your breakfast should look like this: eggs scrambled with vegetables, half an avocado, and a small portion of berries. Not oatmeal with almond milk. Not a smoothie with banana and honey. Protein, fat, fiber. Then, if you're still hungry, a small amount of complex carbs. Every subsequent meal follows the same pattern: Vegetables, protein, healthy fats. Then carbohydrates last. This isn't a diet. This is a strategic manipulation of your hormonal response to food. Step 2. You can reach out to your provider for supplements backed by research to manage PCOS more effectively. You can reach out to a certified cupping therapist for cupping therapy as a complementary treatment, which has been proven to have a positive effect on female reproductive health, including PCOS, menstrual disorders, and infertility, according to the International Journal of Islamic and Complementary Medicine. Step 3. Track ovulation the right way. Because with PCOS, standard methods fail. Forget the calendar method. If you have PCOS, you're not ovulating on day 14. You might ovulate on day 18, day 25, or not at all some months. So, you need 3 tracking methods working together. LH test strips. But here's the critical part everyone misses. Women with PCOS have elevated baseline LH. You're not looking for just any positive test. You're looking for a surge that's 2 to 3 times your baseline. Test twice daily starting on cycle day 10 to catch the surge. Basal body temperature. This confirms ovulation actually happened. LH strips only show the surge attempt. They don't prove an egg was released. A sustained temperature rise of 0.5 to 1 degree Fahrenheit for 3+ days confirms progesterone is being produced, which only happens after ovulation. Cervical mucus. This is your real-time fertility indicator. When you see clear, stretchy, egg-white mucus, that's your 24 or 48-hour window. Sperm can survive 3 to 5 days in fertile mucus, so this is when you need to time intercourse. Most women with PCOS who aren't conceiving aren't timing it right. They're using apps that assume day 14 ovulation. The apps are wrong. Your body tells you when. You just need to learn the language. Here's the intercourse timing that maximizes conception probability. Start when you see fertile cervical mucus. Every other day during your fertile window. Doesn't have to be daily. That doesn't improve outcomes and can create performance pressure that increases stress and cortisol. When you get a positive LH surge, intercourse that day and the next. When your temperature rises, confirming ovulation occurred one more time. That's it. You don't need to have sex 20 times a cycle. You need to hit the 5-day fertile window with precision, quality over quantity. And here's what nobody tells you. The stress and pressure around timed intercourse can actually worsen outcomes. Cortisol, your stress hormone, directly suppresses reproductive hormones. So, if sex becomes a chore and a source of anxiety, you're working against yourself. Approach it with intention, not desperation. Your mindset matters more than you think. Now, let's talk about when you actually need fertility treatments. Because sometimes lifestyle optimization is enough, and there's no shame in that. If after 6 months of optimized lifestyle, supplements, and timed intercourse you're still not ovulating regularly, a complementary treatment, like cupping therapy from a certified therapist, can help. If you're ovulating but not conceiving after 6 to 9 months, the issue might not be ovulation. It could be sperm quality, tubal factors, or implantation issues. So, you might need a comprehensive fertility workup for both partners. IVF is rarely necessary for PCOS alone. Most women with PCOS respond extremely well to cupping therapy. Save the $20,000 plus for IVF unless there are other complicating factors. Here's what nobody prepares you for. Getting pregnant with PCOS is step 1. Staying pregnant is step 2. Women with PCOS have significantly higher risks of 1. Gestational diabetes, 2 to 3 times higher risk. Because the insulin resistance that caused your PCOS doesn't disappear when you get pregnant. It often worsens due to placental hormones. 2. Preeclampsia, high blood pressure in pregnancy. This is linked to the inflammatory state of PCOS. It's serious. It can be life-threatening if not monitored. First trimester miscarriage, 30 to 50% rate compared to 15 to 20% in the general population, because elevated insulin and androgens prevent proper placental development in those critical early weeks. These risks drop dramatically when insulin resistance is managed before conception. Studies have shown that women who stabilized their glucose and insulin 3 to 6 months before getting pregnant had pregnancy outcomes nearly identical to women without PCOS. Your preconception health also determines your pregnancy outcome. This means the 90 days you spend optimizing your metabolism before conceiving isn't just about getting pregnant. It's about having a healthy pregnancy and a healthy baby. Look, I know this is a lot of information. Nutrition and therapy plans, tracking methods, timing strategies. It's overwhelming when you're trying to absorb it all from a video. That's why I created a complete PCOS fertility guide. It's a downloadable resource that breaks down everything I just covered. The exact meal timing strategies, the therapy you might need, ovulation tracking templates, and a week-by-week action plan. If you're serious about conceiving naturally with PCOS, that guide is your roadmap. Link is in the description. Grab it now because we're about to shift gears. We've covered how PCOS affects fertility and what to do about it. But there's a bigger conversation we need to have. What happens if you don't address this now? What are the long-term health consequences of untreated PCOS? That's where this gets serious. Because PCOS isn't just about irregular periods and difficulty conceiving. Those are the symptoms you notice in your 20s and 30s. The real danger is what's happening silently in your body over the next 10, 20, 30 years if insulin resistance goes unmanaged. This is a reproductive issue that goes away after menopause. This is a metabolic disease that increases your risk of some of the leading causes of death in women, and this urgency is not being communicated. Let's start with the most predictable outcome, type 2 diabetes. Women with PCOS have a 4 to 7 times higher risk of developing type 2 diabetes compared to women without PCOS. And it happens younger, often in their 30s and 40s instead of 50s and 60s. Why? Because PCOS is fundamentally an insulin resistance disorder. When your cells stop responding to insulin, your pancreas works overtime. For years, it can keep up. Your blood sugar stays relatively normal because you're producing massive amounts of insulin. But eventually, the cells in your pancreas burn out. They can't keep producing 3 or 5 times normal insulin levels indefinitely. They fail. Your blood sugar starts rising. Prediabetes becomes type 2 diabetes. It's completely preventable. The same interventions that restore ovulation and improve fertility, low glycemic nutrition, therapy, exercise, prevent the progression to diabetes. But if you only address PCOS when you're trying to conceive and then ignore it afterward, you're on the express track to type 2 diabetes by your 40s. Next, heart disease. This is the #1 killer of women, and PCOS dramatically increases your risk. Women with PCOS have higher rates of high blood pressure, high LDL cholesterol, and triglycerides, low HDL, the good cholesterol, atherosclerosis, plaque buildup in arteries, increased risk of heart attack and stroke. A meta-analysis showed that women with PCOS have a significantly increased risk of coronary heart disease, even after adjusting for BMI. This isn't just about weight. The chronic inflammation and insulin resistance create a perfect storm for cardiovascular disease. And it starts young. Women with PCOS in their 20s and 30s already show early markers of cardiovascular risk. Thicker carotid artery walls, endothelial dysfunction, elevated inflammatory markers. Your arteries are aging faster than they should. This isn't something that happens at 60. It's happening now. Here's one that surprises people. Endometrial cancer risk. When you don't ovulate regularly, you produce estrogen without the balancing effect of progesterone. Estrogen thickens the uterine lining. Progesterone, released after ovulation, keeps it in check and triggers shedding. No ovulation means no progesterone. Estrogen just keeps building the lining, month after month, year after year. This is called unopposed estrogen. And unopposed estrogen dramatically increases the risk of endometrial hyperplasia, abnormal thickening of the uterine lining, which can progress to endometrial cancer. Women with PCOS have a 3-fold increased risk of endometrial cancer compared to women with regular cycles. This is why irregular periods aren't just abnormal. They're a cancer risk that needs to be managed, either by restoring ovulation naturally or by using progesterone therapy to induce regular shedding of the lining. Ignoring irregular periods for years is dangerous. Full stop. Here's one most people don't know about: non-alcoholic fatty liver disease, or NAFLD. Women with PCOS have significantly higher rates of fatty liver, even lean women with PCOS. Why? Insulin resistance causes the liver to produce and store excess fat. Over time, this can progress from simple fatty liver to NASH, non-alcoholic steatohepatitis, which involves inflammation and damage. NASH can progress to cirrhosis and liver failure. This is the same liver disease alcoholics get, except you're getting it from metabolic dysfunction, not alcohol. And early stages are completely asymptomatic. You won't feel anything wrong until significant damage has occurred. Let's talk about something that doesn't show up on blood tests but destroys quality of life: mental health. Women with PCOS have dramatically higher rates of depression, 2 to 3 times higher; anxiety disorders, 2 to 4 times higher; eating disorders, body image issues, low self-esteem. Is this just because of the visible symptoms like weight gain, acne, and excess hair growth? Partially. Those symptoms absolutely affect mental health. But there's also a biological component. Insulin resistance and inflammation affect brain chemistry. Chronic inflammation is directly linked to depression. Unstable blood sugar creates mood swings, irritability, and anxiety. And the social isolation of infertility struggles, the frustration of dismissive doctors, the feeling that your body has betrayed you, these all compound a mental health burden. PCOS significantly increases risk of obstructive sleep apnea, even in women who aren't significantly overweight. The hormonal imbalances affect upper airway muscle tone and fat distribution around the neck. Sleep apnea means you stop breathing repeatedly during sleep. Your oxygen levels drop. Your sleep quality is destroyed. And this creates a vicious cycle. Poor sleep worsens insulin resistance, which worsens PCOS symptoms. Women with PCOS also have higher rates of thyroid disorders, especially hypothyroidism, autoimmune conditions, chronic inflammation disorders. Your immune, endocrine, and metabolic systems are dysregulated. PCOS is systemic. It affects multiple body systems simultaneously. I'm not telling you this to scare you. I'm telling you this because your doctor probably didn't. They focus on your irregular periods. They might have mentioned fertility challenges. But did they sit you down and explain that untreated PCOS puts you on a path toward diabetes, heart disease, and cancer? Probably not. And that's medical negligence, in my opinion, because all of these long-term complications are largely preventable with early intervention. The insulin resistance that's causing your PCOS right now, it's reversible. Now that you understand the stakes, both the fertility impact and the long-term health consequences, we need to address the massive amount of misinformation surrounding PCOS, because the internet is full of terrible advice. Wellness influencers making claims that aren't supported by science, outdated medical advice that's been disproven, and myths that prevent women from getting effective treatment. So, let's systematically destroy the 5 most dangerous myths about PCOS. Myth number 1: you can't get pregnant with PCOS. We already covered this, but it bears repeating because it's the most psychologically damaging myth. The truth: 20 to 30% of women with PCOS conceive naturally. The question is timeline and optimization. It might take longer than someone without PCOS. You might need to be more strategic. But the idea that PCOS equals infertility is categorically false. With PCOS, you need to address the metabolic dysfunction first. Once you restore regular ovulation through insulin sensitization, your fertility potential is similar to women without PCOS. PCOS is not a fertility death sentence. It's a challenge that requires specific interventions. Myth number 2: PCOS means you have ovarian cysts. The name polycystic ovary syndrome is actually a misnomer. Many women with PCOS don't have cysts at all. What the ultrasound actually shows is a string of pearls appearance, multiple small follicles arrested in development. These aren't true cysts. They're immature follicles that started to develop, but couldn't complete maturation because of the hormonal imbalance. You can have the classic polycystic appearance on ultrasound and not have PCOS if you don't have the hormonal and metabolic dysfunction. Conversely, you can have PCOS without any visible changes on ultrasound. PCOS is diagnosed based on Rotterdam criteria: irregular ovulation, elevated androgens, and/or polycystic ovarian morphology on ultrasound. You only need at least 2 of 3. The name is misleading and causes confusion. PCOS is fundamentally a hormonal and metabolic disorder, not a structural ovarian problem. Myth number 3, only overweight women get PCOS. Lean PCOS exists. About 20 to 30% of women with PCOS have normal BMI. They still have insulin resistance, elevated androgens, and irregular ovulation. Why does this myth persist? Because obesity worsens insulin resistance. So women who are overweight tend to have more severe symptoms. But insulin resistance can exist at any body size. In fact, lean women with PCOS are often diagnosed later because doctors dismiss their symptoms. You're thin, you can't have PCOS. Wrong. Body weight is a risk factor, not a requirement. This myth is particularly damaging because lean women with PCOS often don't get taken seriously, leading to delayed diagnosis and treatment. Myth number 4, weight loss cures PCOS. Weight loss helps. We covered that extensively in the research. 5 to 10% weight loss can restore ovulation and improve metabolic markers significantly, but it doesn't cure PCOS. PCOS is a genetic and hormonal condition. Weight loss addresses insulin resistance, which improves symptoms. But if you lose weight and then return to a diet high in processed carbs and sugar, the symptoms will return. PCOS management requires ongoing lifestyle maintenance. It's not a short-term fix where you lose 20 pounds and you're cured forever. You need to sustain the insulin-sensitizing behaviors that improved your symptoms. Also, not everyone with PCOS needs to lose weight. Lean women with PCOS need metabolic optimization without weight loss. The focus should be on metabolic health, not the number on the scale. Myth number 5, birth control cures PCOS. Birth control regulates your cycle. It gives you a predictable bleed every month. It can improve acne and reduce excess hair growth by lowering androgen levels. But it does nothing for insulin resistance. It doesn't improve your metabolic health. It doesn't reduce your long-term risk of diabetes or heart disease. It doesn't restore natural ovulation. It's symptom management, not treatment of the underlying cause. And when you stop taking it, all the symptoms return, often with a vengeance, because your body has been suppressed for years. Calling it a treatment for PCOS is medically inaccurate. If your doctor put you on birth control and told you nothing else about PCOS management, they failed you. This is exactly why I created that PCOS fertility plan I mentioned earlier, because the medical system is giving you Band-Aid solutions instead of root cause treatment. That guide breaks down everything you actually need: the insulin-sensitizing nutrition plan, the evidence-based cupping therapy, the lifestyle optimization, the ovulation tracking methods. It's a complete roadmap from where you are now to regular ovulation and natural conception. Link is in the description. Download it, use it, and let me know your results. I genuinely want to hear your success stories. Now, we need to talk about something crucial that ties all of this together: prevention and early detection. Because if you're watching this in your late teens or early 20s, you have a golden opportunity to prevent the worst outcomes of PCOS. Here is a blood test that predicts fertility outcomes better than ultrasound. Fasting insulin, not fasting glucose, not HbA1c. Fasting insulin. Here's why this matters. Your blood sugar can be normal for years while your insulin is sky high. Your pancreas is compensating, remember? It's producing massive amounts of insulin to keep your glucose in range. By the time your glucose starts rising, you're already deep into insulin resistance, sometimes irreversibly so. Fasting insulin reveals the problem years earlier. A fasting insulin above 10 indicates early insulin resistance. Above 15 is significant insulin resistance. Above 20 is severe. Most doctors don't order this test. They check fasting glucose and call it a day. But fasting insulin is a canary in the coal mine. It's the early warning system that can catch PCOS and prevent progression to diabetes. If you have irregular periods, get your fasting insulin checked. If it's elevated, you know you need to intervene now, not when your glucose starts rising in 5 years. If you're in your late teens or 20s and you're experiencing irregular periods, excess hair growth, acne, or other early PCOS symptoms, here's what you need to do now. 1. Get comprehensive testing. Fasting insulin, fasting glucose, HbA1c, total and free testosterone, DHEAS, LH, FSH, vitamin D, thyroid panel. Don't accept your glucose as normal, you're fine. 2. Implement the nutrition plan now. Don't wait until you're trying to conceive. The earlier you address insulin resistance, the more you prevent long-term damage. 3. Build muscle through strength training. Muscle is the most insulin-sensitive tissue in your body. More muscle means better glucose disposal and insulin sensitivity. This is preventive medicine. 4. Manage stress and prioritize sleep. Chronic stress and sleep deprivation worsen insulin resistance. These aren't optional, they're foundational. 5. Advocate for yourself. If your doctor dismisses your symptoms because you're young or not that overweight, find a new doctor. Early intervention prevents the cascade of complications. The interventions that reverse PCOS symptoms also prevent the development of PCOS South in the first place if you're at risk. Let's shift for a moment and talk about hope, because everything I've shared might feel overwhelming or scary. But here's the truth: PCOS is highly responsive to lifestyle intervention, more so than almost any other chronic condition. There are women who hadn't had a period in 2 years start ovulating regularly within 3 months of implementing the insulin sensitizing plan. There are women who were able to reverse prediabetes, lose 30 pounds, clear their acne, and regain confidence in their bodies. This isn't rare. This is the norm when women address the root cause instead of masking symptoms. Your body isn't broken. It's responding exactly as it should to insulin resistance. Fix the insulin problem, and your body will heal itself. You have more control over this than you've been led to believe. Living with PCOS requires a mindset shift. You didn't cause this. PCOS has a strong genetic component, but you can control how it manifests. Think of PCOS like nearsightedness. You didn't cause your poor vision. You inherited genes that predispose you to it, but you can wear glasses or contact and function perfectly well. PCOS is similar. You inherited genes that make you more likely to develop insulin resistance, but you can manage that insulin resistance through lifestyle and prevent or reverse the symptoms. You're not a victim of your diagnosis. You can be equipped with knowledge and tools to manage it effectively. That's why I'm giving you the complete roadmap in that PCOS fertility guide. It's not just about getting pregnant, though that's a beautiful goal if it's what you want. It's about reclaiming your metabolic health, preventing diabetes and heart disease, reducing your cancer risk, improving your mental health, feeling in control of your body again. This isn't about perfection. It's about progress. It's about having the information you need to make empowered decisions. Grab that guide, implement it, and share it with every woman in your life who's struggling with PCOS or irregular periods. This information saves lives and prevents decades of unnecessary suffering. Link is in the description. The research proves it. Women who implement comprehensive lifestyle interventions see dramatic improvements in 90 days. 3 months. That's all it takes to fundamentally shift your metabolic trajectory. But you have to start. You have to commit. You have to believe that you're worth the effort. Because you are. PCOS doesn't define you. It's a condition you're managing, not your identity. You're not a PCOS woman. You're a woman with PCOS who's taking control of her health. If this video changed how you think about PCOS, if it gave you hope or actionable information you didn't have before, hit that subscribe button. Because I'm breaking down complex medical research every week, fertility, hormones, metabolic health, and cutting through the BS that's keeping you sick. Drop a comment and tell me, what was the most surprising thing you learned in this video? What myth did you believe that's now been shattered? I read every comment. Your body isn't broken. It's just asking for balance. Now go give it what it needs.